I don't know how you.
Me too.
Yeah. You get anything else? I need to go to another meeting. Okay.
I'd love to talk to you for just a second.
All right.
Hang on, sorry. I'll just be really fast. You know, I don't know if you really need to talk, but. No, it's okay. I just wanted to ask you, there was some
Between that and brownies and donuts.
libertarian, influence
Sugar high.
I'm wondering, as Senator Stevenson, the governor's.
Okay.
Obscure.
Here, wait a minute. No, you can-
Dan, can I get you to shut that door for me?
I'm just filler. It's,
All right, let me know when you're ready.
Go ahead.
Okay, let's begin.
Welcome to the Senators. That's one of the suggestions, a new name for our media availability after our floor time. If you have some suggestions, please send them in. We'd like to have something a little bit more flashy than media availability. So welcome to our access today, and thanks for those who are watching on the internet. Please send in your questions, and we'll take questions from our media representatives.
Some of your colleagues in the higher education budget meeting this morning said that they think higher ed, that athletics might not be the place for taxpayer money. USU got its $1.5 million last year. Weber seems poised to get a little bit less than that this time around. What is your response to that criticism?
Well, I'd probably defer to our appropriations folks today.
It's all going
Senator
through the
Hilliard?
process, so I have no idea what the recommendations are going to be. They'll make them Tuesday or Wednesday and Thursday night. We'll hit the recommendations, and then when we get the final revenues on the 22nd, we'll start prioritization. We look heavily at what the committees recommend, and so
Should Weaver get the same treatment as Utah State?
Well, I guess you can say, yeah, Weaver State and SUU are not in the same league that Utah State is. When I understand, the Big Sky is not requiring their teams to do the full cost of attendance like Utah State is in the Mountain West, or like Utah is in the Pac-12. So I think there's clearly a distinction between those. But I think the decision of the legislature, what they want to do.
Could I respond to that?
Yes.
I was in the
Stevenson.
committee meeting this morning, and I think the number is, I believe it was 1.3 million, but the motion was made so that it would divide that 1.3 million, not necessarily evenly, but it just recommended that the money be split. So.
And I've heard the same thing that maybe through Snow College and Dixie College, because they have football teams. UVU doesn't have a football team. They have a basketball team, so their costs, I would assume, do significantly less. But again, the presentation we did last year on Utah State was the fact that we're in the Mountain West. Mountain West was requiring all their teams to do that cost of attendance. And I think that was the reason why Utah State was funded last year.
So Senator Davis has joined us, our minority leader. We're talking about funding athletics at universities.
Better than trying to control the agendas.
Any other questions from our media? Yes.
Do you see any appetite for the Senate taking up the e-cigarette issue?
Well, I think that, I don't know of a bill. Do you know of a bill that's out there?
There's a bill in the
Red
House.
Prey introduced one yesterday.
Okay, all right. I think
would
there's some
raise-
appetite for a discussion on that. I think we recognize that while e-cigarettes are probably less harmful than smoking cigarettes, that we probably ought to treat them the same way, based on harm, the same way we do other tobacco consumption. And at least the indications are that the harm is substantially reduced, so maybe the tax would not be the same as a cigarette. Maybe it should be less, because there are folks trying to quit the habit of smoking cigarettes, and at least e-cigarettes have been a solution to that. Although, nicotine is an addicting substance, and it's hard to break that habit. But so I will vigorously debate that bill when it comes here, if it does come here.
There's some thought that money would be used to fund, not Medicaid expansion, I guess that term is off the table, but expanding traditional Medicaid to some of the populations not covered under the Affordable Care Act. Does that make it more likely that an e-cigarette tax would pass, the fact that that money could be targeted toward that new program?
I think it creates a greater argument to pass a bill on e-cigarettes because it will have a purpose. And I know Senator Dunnigan has or Representative Dunnigan has a bill to expand traditional Medicaid. And so we're going to need to fund that. And where's that money going to come from? Well, that's a possibility. I think it raises the stakes for an e-cigarette tax bill.
Also raises the question of addiction. Who becomes addicted, the state or the person that's smoking e-cigarettes?
Yes.
That's
Or is that an earmark?
Are there other funding proposals that you're aware of or that the Senate has maybe been discussing privately for funding some kind of
Nothing that we've
Medicaid?
been discussing privately. I know that Senator or Representative Notwell has a bill on single sales factor. Actually, that's not a revenue, that's a decrease in revenue, so sorry about that. Who else has a revenue tax increase bill?
Well,
I don't know of any.
No one's
really.
talked to me about it.
Yeah, I don't know of anything.
I was wondering though about methods of funding the new Medicaid proposal. If the Senate has talked about what you'd find acceptable in terms of earmarking revenue for
We
that.
really haven't talked about that yet. I've anticipated it a little bit. We don't have a lot of general funds, as Senator Hilliard and Senator Stevenson will tell you. But we might have to kind of force that into, if we do pass Senator Dunnigan's bill or Representative Dunnigan's bill and want to, I don't know, so you can run for the Senate or something. If we get that passed, we're gonna have to figure out how to fund it, and we're gonna have to probably force it in the budget in that general fund area, because I think it's $20 to $30 million, and maybe the hospital association will kick in a little bit of money. We'll pass an e-cigarette tax bill. There's the preferred drug list for mental health drugs. I think that generates a couple $1 million, but I don't know if that'll even pass. So those are some of the options that we have to fund Medicaid expansion if we pass a bill.
I think the 30 million gets us halfway there on the full Medicaid expansion. So that's something I think we need to look at as well. Because I think even though the appetite is not here for it, I think it's one of those issues that we need to continue to work towards.
Yeah, it's a 90-10 versus a 70-30.
Your plan, though, as the Senate, is to wait and see what the House will pass, because last year you did have a proposal, they did not accept it.
But we hadn't funded it last year either. We passed it out, and we're working on figuring out how to fund it. That's one of the big problems. Yeah, it's not easy because if there's not revenue enhancements, tax increases, then we got to stick it in the budget that you have, and that means less money for other programs. Probably a little shave on education. The growth in social service programs would be curtailed because you don't have that money anymore. If we had passed that last year, the Medicaid reimbursements to anesthesiologists and about the 3 other areas, I think would have been challenged. We may not have been able to do those things, and getting a reasonable reimbursement rate to those providers is really important, because otherwise they don't want to take Medicaid patients because it's a loss for them, and that's so to keep medical providers at the table, you got to have a reasonable reimbursement rate.
That's one of the things that most states have used a hospital tax to be able to reach that, because a hospital, for an example, the University of Utah claims they lose $100 million a year in uncompensated care. They would get all of that back on the table if we did full Medicaid expansion. Most all of that $100 million would be paid for by Medicaid.
And I'm sure they would cut their rates because they wouldn't need $100 million to take care of the charity care.
It wouldn't be the rates. That's the reason I say that a lot of states have been using the hospitals to be able to pay for that, because of the fact they do get a windfall if we were to do full Medicaid expansion.
And that was a consideration that we had last year. But most states that have passed it with a hospital assessment tax, whatever you want to call it, it wasn't done entirely on the backs of the hospitals. And consequently, they're going to be facing budget issues that they haven't faced before in the 2017 budget year, because it's been zero. The federal government has provided 100%. Now it's going to phase in over the next 4 years to 2021, where we pay 10%. And yeah, that's 10% seems like a small amount, but that's $70–80 million, and we don't know what it's going to be actually in the long run, because if you expand, somebody shows up to the door and meets the qualifications for Medicaid, you have to provide that to them. And anyway, that's budget issue is a real question. And it's going to be a real big question among other states. I have an association with Senate presidents across the country who have passed this. They're not considering what the budget impacts are in 2021.
Given that situation, are you now pleased that Healthy Utah didn't pass? It passed the Senate, but did not pass the House. It was supported by the governor.
Well, we wanted to, when we passed this last year, it had a hard sunset in 2 years, because the question was, how many are going to show up and meet the requirements of Medicaid? We'd had predictions, but nobody knew for sure. And we felt like, at least in the Senate last year, that what the Milliman report was telling us, and our fiscal analyst, the $78 million, we think that by 2021 we probably could cover that. It would curtail probably some other social service program growth, but it would cover the gap plus, our participation in the 100% to 138%. And but we didn't know what the budget impact was going to be. That was a reasonable prediction, but what if more showed up and this is going to be $100 million or $120 million? We wanted to have a reset in 2 years so that we could determine whether this was going to be a budget buster or we would need to kind of reduce, go to a different plan. One of the plans was to add the Utah Cares as the substitute plan in 2 years if, the budget impacts were more than we thought.
One thing to remember also, the idea behind that 135% is we have such a great economy in the state of Utah. As incomes grow, family income grows, and you grow out of that 135% of poverty, the area that would be covered. Because really what you're covering are working poor. And by moving that on and getting wages up in the state of Utah, you grow out of that impact on the Medicaid. Because this isn't like traditional Medicaid. This is something that really is a benefit coverage, if you will, or healthcare coverage and access for those who are earning a lot less money than they can afford a premium or the $2,500 out-of-pocket co-pays.
Something going to pass this year? What's your prediction at this point in the session? We're almost at the halfway point. We haven't even seen a bill.
Well, I'd say 80% of the bills that passed in the last half of the session. So I think there's a strong possibility that if there is a bill that's passed from the House, we'd like to see it, obviously. I believe the Senate can get behind it. Great question, great discussion.
Can I ask one more on it? I mean, and you kind of probably already touched on this, but that what's being discussed right now by Representative Dunnigan in the House is kind of falls into the same category as what we talked about before, where you're getting a reduced match, covering fewer people, spending more money to do it with lower level of benefits. Is that just the best that we can hope for at this point?
Yeah, and I don't think it's a bad plan because what we're going to do is take a more incremental approach to this. At first, it seems like why don't we just take the money and move forward and then deal with the problems that arise later on and have to deal with the budget issues that arise if more people show up to the door than we had predicted. But if we did take an incremental approach, we get the, maybe 10 to 20, 30% of that population covered now. In a couple of years, we'll increase that. And then by 2021, we've got the 0 to 100% covered through traditional Medicaid. And I'm of the opinion, because the initial numbers on the Senate plan 2 years ago, which was the 100%, the GAP plan, the numbers then showed that the 10% of 138% was the same as 30% of 100%. And that's so there's I'll explain that 0 to 100% coverage, which the Senate plan was 2 years ago. The cost in 21 to the state was the same as if we'd expanded full expansion and had to pay our 10% of the 0 to 138%. And then the Millen report blew that out of the water, showing there a $50 million gap. But in my study with the Gang of Six this last year, we discovered the Millen report really wasn't based on a lot of data. It was what was happening in other states, and we really weren't landing on something solid there, but it was the best report that you could get. So it's my opinion, personal opinion, just because I've seen growth in just traditional Medicaid over the years, way beyond what anybody ever thought when it was passed, is that I believe those numbers will cross at some point where actually you might even save money by focusing on the 0 to 100% at 30 versus taking the responsibility, a 10% responsibility of that whole population.
So let me make sure I understand what so you're saying that if you're covering fewer people, the percentage growth will eventually mean that because you're covering fewer people, if it grows by a given percent, you'll eventually end up saving money because the cost trajectory.
Even though if we cover the 0 to 100%, everybody's covered.
Yeah, right.
Because the feds will be covering the 100 to 138%.
The only problem with that is they're buying the traditional insurance out of the exchange, and those people in that gap, if you will, don't have the $2,500 out of pocket to be able to ever get to the health care, or they'll be in debt because they can't pay it. So it's one of those issues of of facing that working poor issue and trying to get that out and either get wages up so fewer people qualify in that gap, or we get them the coverage that they need. And that's the Medicaid expansion versus what will happen to these individuals anyway. So there's a lot of pluses and minuses.
I just know people in that gap, and they get a silver plan and fully subsidized. You know, they do have their deductibles to pay, and there's some stop losses, but I know my daughter has a plan. It's a $2,500 deductible. If she goes to the doctor, it's a copay.
She's in that 100 to 138, though, is what you're talking
Yes.
about.
It's about access more than anything. We're looking at it from a legislative point of view as totally a cost factor, which is trying to balance the budget on that. The flip of that is the fact of getting access for everyone in the state of Utah to health care. That's the dynamic, I think, of both sides that we're looking at, and that's where we're at, and having a hard time finding the common ground to grow that.
It's the art of the possibility.
One thing that happened,
and I think something is better than nothing.
and I take a look at in Colorado where they went to their traditional Medicaid plan to begin their full expansion because the Affordable Care Act wasn't there. And the biggest problem they're having now is qualifying those individuals that they qualified in the traditional Medicaid plan to get into the 90-10. And they're a 50-50 state on their match. So there's a lot of savings there if they can get to the 90-10. And so they're having a hard time qualifying because they qualified people in this plan or in this Medicaid program, traditional Medicaid program. These people then have to be re-qualified to be able to come out into the other plan. They're two separate plans, is the Medicaid.
Any other questions? Anybody have any questions
We didn't
from
have
our
questions,
viewers?
but we had a couple suggestions on what you should name this.
Oh, good.
Okay. Utah Senate glass doors. Wayne's World.
Party on.
That came from
Party on, Jerry.
That came from somebody in the room. Senate Slam, Keeping Up with the Knudsons, or Hello from the Senate Side.
Thank you for the suggestions. One other suggestion that I thought was a good suggestion also is the Senate chat.
Senate chat.
Okay, well, thanks for viewing. We'll be back on Tuesday. We won't be here on Monday. It's Washington Lincoln's holiday on Monday, and so we'll see everyone on Tuesday.
Encore presentation.
Wayne's World. That's actually Wayne's World. That's really good.